Welcome back to the Morning Blend. The mental health of the senior community is the mission of our next guests. Montevista Hospital, they provide inpatient and outpatient geriatric care for families throughout the valley through a specialized unit called Red Rock. And here with more is geriatric psychiatrist Jason Cheng, along with a licensed clinical social worker, Betty Russell. It's great having both of you. How are you?
Thank you.
Pretty good.
It's great to have you here today and talk about geriatric psychiatry. What exactly is that?
So geriatric psychiatry is a subspecialty in psychiatry where the focus is on anyone age 65 or above.
Okay.
There might be rare cases where we have people that are younger than 65, but those are individuals that have some kind of some form of dementia.
Okay.
And we can also treat those individuals.
Fantastic. I know obviously a lot of families, they come in, there's a lot of questions, they don't know perhaps what they should have been looking out for. Is there anything that a family at home, if they have an elderly parent, if they're starting to see certain things possibly deteriorate, what should we be looking for?
So in general, geriatric psychiatry, we treat everything. It's not just related to dementia.
Okay.
So when it comes to depression, it's the same as, you know, in younger individual who has been having suicidal ideation, they're not eating, they're not able to care for themselves.
Yeah.
So those are signs of severe depression, which requires medical attention. Now, when it comes to dementia, if an individual is having increasing agitation or combativeness, in that case, they can always refer to us and we can try to help decrease their agitation.
Wow.
In that regard.
Absolutely. Betty, let's talk about the team at Montevista Hospital. What can we expect from the clinical team?
Oh my gosh. Well, first of all, I have worked nowhere else that the thing that leads our team is compassion and kindness. So that's the baseline and what you expect from our team walking in the door.
Absolutely. I know a lot of families, when they enter any hospital or any sort of clinical environment, it can be a very stressful time.
Yeah.
They don't know what's going on with their parent. They want to be able to help, and you actually provide a way that families can be involved with the treatment, right? Tell me about that.
So we understand that the patient is not just the patient, and that it's about who is their support team. And so there's always usually some family members that are involved, and that's the thing that we seek out, because we want to address the whole family and the environment. So we have treatment teams where we highly want the families to participate. We have visiting times for the families, and we really work with doing family therapy with the clients and whoever it is that they call their team.
Absolutely. What else makes Montevista so special? Tell me about the facility. Where is it located?
It's at 5900 West Rochelle Avenue.
I mean, one of the great things is, for our unit, it's specifically for the geriatric population. So we cater our care all the way down from the therapeutic sources, our psychiatrist, and our whole team is educated on how to interact appropriately with those with dementia or that kind of thing as well, which is great. And
it is important that you pointed out earlier in the interview about you're not just helping the person, the person that needs the psychiatric help, but it's really the whole family, because this is doesn't just affect one person.
Well, and I think it's important too. A lot of families wait a long time before seeking help, and when intervention could have saved a lot of trouble and a lot of stress. And it's scary, but we are here to kind of intervene and communicate with them through the whole process. Which
is why it's so important, if you do suspect anything, see any warning signs, to get in touch. How do you get the ball rolling and maybe perhaps set up a consultation?
So you can certainly call Montevista Hospital. Also, we have an assessment center, so you can just bring them right to us. It's open 24 hours, 7 days a week.
Absolutely, and I know that you provide both in and outpatient care as well. So whatever is right for the family or that situation is what you provide.
Exactly.
Absolutely. All right, if we want more information, where do we go? Website?
Good place to start. Give us a call.
All right, very cool. Montevista Hospital, thank you so much.
Thank you.
It's great having you. Montevista Hospital, they provide inpatient and outpatient psychiatric care for all ages. And you want to learn more about them and their Red Rock unit, you can just visit their website or call the number you see right there on your screen. Montevista Hospital, all over social media, and they are a proud sponsor of the Morning Blend. And